Chest pain, shortness of breath, and a feeling of fainting are among the main symptoms of a myocardial infarction, more commonly known as a heart attack. It is a potentially fatal condition that occurs following the death of a part of the heart's muscle tissue when it is no longer reached by a sufficient amount of blood and therefore oxygen. Almost all heart attacks, however, are not caused directly by the accumulation of cholesterol or triglycerides on the walls of blood vessels, but by the formation of blood clots in one of the coronary arteries that supply blood to the heart. This incredible discovery was made in the mid-1970s by British researcher Michael Davies, who, in an attempt to find a cure for heart attacks, studied the hearts of people who died from heart attacks. A discovery that revolutionized the understanding of the mechanisms that lead to myocardial infarction. But let's look at it in more detail. A blood clot, also known as a thrombus, is nothing more than a solid mass made of fibrin, a protein that acts as a sort of net in which other blood cells, such as platelets, red blood cells, and white blood cells, are trapped. In the case of a myocardial infarction, clots form following the rupture of an atherosclerotic plaque in the coronary arteries. This is an accumulation of cholesterol, fats, calcium, and other substances that are gradually deposited along the walls of the arteries, and that over time cause the hardening and loss of elasticity of the arterial walls. However, when one of these plaques suddenly ruptures, the body reacts by activating the clotting process to repair the lining of the damaged artery. Blood clots are thus formed, which could seriously worsen the occlusion of the affected coronary artery, cutting off blood flow to part of the heart. The lack of oxygen then leads to the death of heart cell, causing a myocardial infarction. According to the study conducted by researcher Michael Davies, it was discovered that these blood clots formed precisely in those arteries that had been narrowed by atherosclerosis. This overturned the widely held view that these blood clots were the result rather than the cause of heart attacks. To reduce the risk of blood clots, it is important to act on the so-called modifiable risk factors, that is, those that can be addressed through lifestyle changes or by taking medications. The number one enemy of the heart and arteries is definitely cigarette smoking. The more than 4,000 chemicals in a single cigarette, of which 40 are carcinogenic, not only help damage artery walls, but also make certain proteins in the blood stickier, increasing the risk of dangerous blood clots. A study conducted at the University of California found that acute exposure to cigarette smoke alters fibrin architecture and causes a series of functional changes in platelets and fibrinogen, thus affecting clot formation, stability, and dissolution. Smoking has also been shown to induce hypercoagulability, also known as thrombophilia, which is an alteration of normal blood clotting that leads to an increased risk of blood clots, and therefore arterial thrombosis. Another risk factor that increases the likelihood of blood clots is high blood pressure. This is a medical condition characterized by blood pressure in the arteries that is higher than normal physiological values. If left untreated, it can damage the walls of the arteries, causing thickening and stiffening of the vessel walls, making them more susceptible to developing atherosclerosis. Hypertension thus leads to a series of changes in platelets and the endothelium, the layer that lines the blood vessels. Not only that, it also alters the normal balance between coagulation and fibrinolysis, compromising the body's ability to dissolve clots once they have performed their function. Untreated hypertension therefore promotes a prothrombotic state, that is a greater tendency of the blood to form clots, increasing the risk of myocardial infarction and stroke. Another risk factor that should not be underestimated is hypercholesterolemia, which is when high levels of cholesterol are recorded in the blood. As it is deposited on the walls of the arteries, atherosclerotic plaques form, which, as we saw at the beginning of the video, when they break, can give rise to the formation of blood clots, both in the arteries and in the veins. In the first case, they are mainly formed by platelets and are responsible for a myocardial infarction or a stroke, while in the second case, they contain more fibrin and can cause deep vein thrombosis or pulmonary embolism. Diabetes is another major risk factor for heart attack, as high blood glucose levels can damage the blood vessels and nerves that control the heart. Over time, this damage can lead to cardiovascular disease, which is the leading cause of death in diabetic patients. This is because hyperglycemia promotes a state of chronic inflammation in the blood vessels and causes a series of abnormalities in the coagulation process, as well as influencing fibrinolysis, endothelial, and platelet function. Diabetes mellitus is therefore associated with an increased risk of blood clot formation, which can lead to fatal complications, including myocardial infarction. Sedentary lifestyle, overweight and obesity, but also the use of hormonal contraceptives, and the use of hormone replacement therapy are other risk factors linked to a higher risk of blood clots. The latter is a drug therapy based on the administration of hormones, estrogen and/or progestins, to relieve the symptoms of menopause. According to a study conducted by researchers from Oregon, the risk of thrombosis with compounds containing estrogen, unlike those containing only progesterone, increases with the increase in the systemic dose of estrogen taken. For this reason, when considering hormonal contraception or hormone replacement therapy, doctors must always first evaluate several factors, including the type of hormone, the dose, the route of administration, and the personal and family history of thrombosis. However, as the Italian Medicines Agency reminds, for most women, these drugs offer benefits that far outweigh the low risk of serious side effects. The likelihood of a blood clot forming with the use of a combined hormonal contraceptive is higher in the first year of use, but still higher than for those who do not use them. Numerous studies conducted over many years have provided good evidence that the risk of blood clots may vary between combined hormonal contraceptives, probably depending on the amount of estrogen they contain and the type of progestogen used. In conclusion, we have seen that the formation of blood clots is a crucial factor in the development of myocardial infarction and other cardiovascular diseases. To reduce the risk, it is therefore important to stop smoking, control blood pressure, maintain adequate levels of cholesterol and glucose in the blood, practice regular physical activity, and maintain a normal body weight. Furthermore, for those taking hormonal contraceptives or hormone replacement therapies, it is important to always evaluate, together with your doctor, the relationship between risks and benefits.